Hey everyone, I'm going to be talking about my organization. So, the name of my agency, I work for, or not work, I intern at a private practice agency. Um, the name of the agency is Tend Play Therapy and Family Wellness. The mission is to provide therapeutic services to children and families through play, therapy by affirming LGBTQIA plus youth, and supporting gender identity development. The vision is to create a safe and affirming therapeutic environment where children and adolescents can explore identity and strengthen family relationships. And our core values are LGBTQIA plus affirming care, gender affirming therapeutic practice, strength based approaches, and accessibility. The primary services we offer are individual play therapy for children. We also offer talk therapy for adolescents and adults. And then um, we do a lot of gender affirming therapy for LGBTQIA plus youth and children, as well as adults. And we also support youth that are navigating gender transitions, and we provide parent education and consultation as well. Clients of agency, so the main population are children and adolescents, seeing as it's mainly play therapy that we offer, and this is mainly for LGBTQIA plus youth. Um, but we really take anybody. That's just like the main population we serve. And then the secondary population would be parents and caregivers slash adults. Um, the most common presenting concerns we see is usually anxiety, depression, identity exploration, and family conflict. And then our main payment source is usually Medicaid, private insurance, or private pay. When we do private pay, we do a sliding scale just based on income. So we really just say like pay what you can. So some clients pay a lot more, some pay less, and then we also offer pro bono services depending on the client. And we have about 25 clients in total for the whole practice. For the agency structure, um, this is a private clinic practice for profit. It's a very small organization, so not a big practice at all. Where we have one licensed clinician, which is the owner, Al Smith or Al Warner Smith, and then we have one MSW intern, and then the BSW intern, which is myself. As far as agency climate, we are affirming and we are in a affirming and inclusive environment. We have a strong emphasis on safety for LGBTQIA plus youth. We're very client centered and identity affirming in our approach, and we have a lot of collaborative supervision structure. So the head clinician, the owner of Tend Play Therapy, they like to take a more collaborative approach rather than looking at themselves as a supervisor and the other two as interns. So their approach is we're all adults here, we're all working to build the same environment, so let's be more collaborative. Um, as far as behavior expectations, we use a lot of affirming language and correct pronouns. We have very strict confidentiality practices. We practice a lot of cultural humility and awareness of identity-based oppression. We do a lot of ethical documentation and try and maintain an inclusive environment as much as we can provide and are able. And then some unwritten rules that we have in the private practice would be affirming of client identity in all of our interactions, collaborative environment, like I was saying before, And then remaining aware of LGBTQIA plus practices, and then having professional boundaries with the kiddos that we work with. As far as communication, we do a lot of supervision meetings. We have a lot of collaborative meetings and communication when it comes to the cases and consultations of new new clients being brought in. For diversity, it's a really small environment, so there's really not that much demographic diversity. The main clinician does, I believe they do identify as queer, they do identify in the LGBTQIA plus community. So that is some diversity that we bring, and other than that, we are all three white females, so it is less diverse than some organizations. And interns, I feel like we do contribute to the diversity of different perspectives. So rather than just having one perspective from the main clinician, you also have an MSW intern and a BSW intern bringing in their perspectives. As far as improvements needed, I would say there are little improvements needed because it is such a small practice and it is very new. It's only been up and running for 3 to 4 months, I would say. I would say, so not much room for improvements other than maybe being able to offer bilingual services, or if they choose to bring on more clinicians in the future, bringing on clinicians that do have that LGBTQIA perspective and experience that they can bring into sessions with their clients. For policy, we have 2 policies that impact our agency. HIPAA is a big one that's relevant when working with minors, exploring gender identity, obviously, and remaining confidential and being aware of what we are saying in our documentation, just because of the political climate. So really being confidential and aware of how we're documenting. And then we also have the Medicaid policy and gender affirming care regulations that impact our agency, and this determines whether services related to gender affirming care are reimbursable, and it does influence accessibility for low-income LGBTQIA youth. The impact and justice implications. So when it comes to economic, Medicaid allows marginalized LGBTQIA plus youth to access affirming therapy. For social, state level policies around gender affirming care affect the safety and accessibility of the services we do offer. Structural oppression, transgender youth face systemic discrimination in healthcare and education systems. Affirming therapy act as a protective factor. And then when it comes to ethical considerations, just balancing minor confidentiality with parental rights. And as I was saying before, balancing the protection of the client when it comes to documentation and having to turn that into insurance. For organizational evaluation, no large-scale formal program evaluation just because of its size. We do have ongoing informal evaluations through supervision, which happens on a weekly basis. And what is evaluated in that is the client progress toward treatment goals, emotional and behavioral stabilization, family functioning, and then obviously evaluating intern performance and bettering intern practice. For anti-racist and anti-oppressive practice, for observations, agency actively affirms LGBTQIA plus identities, Gender affirming care challenges heteronormative and cisnormative thinking. Medicaid acceptance increases accessibility, and trauma informed approach. We use a trauma informed approach that recognizes systemic harm. And then the focus of efforts, it's very client focused through affirming therapeutic practices, and then intern supervision include discussion of biases and cultural humility. When it comes to collaboration with interagencies, we work a lot with Medicaid and private insurance providers, so collaboration to provide reimbursable mental health services to clients. Our purpose is to make sure clients just get access to therapy services. And the person that benefits are the clients who rely on Medicaid and private insurance to access care. As far as history for the collaboration, not much to say on that one. Collaboration began when an agency enrolled as a provider with Medicaid and the private insurances. For MOU, we have no separate MOU that exists. As far as our strengths and challenges, for the strengths, we do expand access to therapy for economically marginalized families, and therapy that supports LGBTQIA plus youth. We are also one of the only agencies in Colorado. I think there might be one other agency that offer play therapy. So that is definitely a strength as well. As far as challenges, when it comes to private practice, you don't really make that much money. Small reimbursement rates happen, so the head clinician gets paid pretty small amount, based on like how much the insurance gives back to them. And then I would say another challenge is just needing to maintain insurance requirements. So we do need to maintain like a certain plan for the client, whether we feel that is needed or not. And then we also need to just be really careful and aware of how we document, because we are working with the LGBTQIA plus youth. And then for funding, services are funded through Medicaid, private insurance, and private pay. So yeah, that is my agency. Not much to it because we're so small, but yeah, hope you guys enjoyed.